I'm here with Dr. Nancy Ying, and we just hit record. And this is super fun because this is her first video podcast style show. So first, welcome to your first video podcast. I'm glad to be the first.
Thank you so much for having me. This is very exciting.
It's going to be fun. It's going to be fun, I promise. So what you do, doctor, and you like to be called Dr. Nancy.
Yes.
True? Okay.
Yes.
So, Dr. Nancy, what you do is, you share a lot of commonality with most of the great vets that come on our show. So holistic veterinary medicine, you do kinesiology, you're very diet focused. So let's talk what you do that's somewhat unique, I think, is you do a lot of house calls in New York.
Yeah, that's all I do, 100%.
That's amazing. So that's what I would like to do if I was a vet. I would like to do a lot of house calls. Yeah. So what would you say, let's talk about have you ever been in a practice? Have you ever practiced in an actual, okay. Can you tell us the difference? I want us to paint a picture and a feeling of most people know what it's like being in a vet's office, but then I want to hear just the difference, the delta between that and what you do.
Oh, yeah, got it. Yes, of course. So what I really like about doing house calls is that I get to go to their house. So it's an environment that the animals are comfortable in. And you know how a lot of times people say that, my dog, my cat hates going to the vet, it's super stressful, they freak out. Well, the thing with my patients is my clients tell their pets ahead of time that I'm coming because they are excited for me to be there and to see them. And when I come to the door, they run to the door, they greet me, they're excited to see me. So everything is just much more, it's just nicer, it's not as stressful. Especially for the cats, the cats can be comfortable in their environment. A lot of times I do my exam on the couch. So I sit on one side of the animal and then in the owners on the other side so that, so we just kind of, keep them there and then I can do my exam and do my treatments on the couch.
Well, it's like you're a visitor in the home. That's all it is. It's like, you're not poking them and prodding them, but it's almost like you're petting them and, loving them, and you're probably palpating or you're feeling a joint or something, right?
Yeah. Well, the funny thing is, when I start my exam, I go from a vet. I go from a visitor to a vet, and then I start looking in their ears and stuff, and they're like, oh my God. But they're not freaking out, they're like, okay, she's not who I thought she is, but I'm still kind of okay with it. And then the owners are, petting them, telling them it's okay.
Yeah.
So, and then a lot of times I try to be very gentle with them. So I'm not Yeah. And then I do acupuncture on the couch. So, they get comfortable there. Or on the bed, whatever they want to be.
Yeah. Yeah. Do you go to couches all the time, or do you just go where they like to be?
I go in and I assess the situation, meaning that if they look like they're hanging out on the bed, then I'm not gonna move them, I just go with them. But if they're kind of walking around or they're on the smaller side, then we're just gonna plop them on the couch.
Yeah. So I know your mom inspired you to, eat lots of fruits and vegetables, mm-hmm. and that informed your opinions and your view on diet. So real quick, what is your view on diet for dogs and cats, overall?
Overall, I think is the most important thing that I do. It's the first thing that I address when I see a new patient. And it's the first thing I have the owners do. If they're on a dry food diet, I told them you got to change it the best they can. And I try to get them to change to, I call them non-processed diet. So
Sure.
either raw, cooked, or freeze-dried. And then, but if they have to, they can do some canned. It's not what I prefer, and definitely no dry food.
Yeah, that's great. Well, that's the perfect encapsulation. Perfect. If anybody has ever watched our shows, like this is just the constant theme. If I had to pick one theme, that's it. All the best vets all over the world are saying the same thing, all of them. And that's what it is, no processed diets. Okay, so let's go back to house calls. So for people who have the ability to find a great vet that'll come to their home, besides the fear-free part, where they're in their home turf, what's the other benefits to animals for, having a veterinary visit in their home?
I think the convenience.
Sure.
Yeah, and the time. So in the regular clinics, there's like a 15-minute appointment, 30-minute appointment if you're lucky. For me, it's about an hour to an hour and a half. I'm in the house.
Amazing.
So I go slow. I take my time. And I'm there to answer the owner's questions.
Yep.
And also it's just more relaxing. The people are more relaxed, animals are more relaxed.
Do you feel like you get a better medical result because everybody's relaxed?
I feel like my owners, in my clientele, they tell me more stuff. And I can see what's going on in the house. I can walk by, I'm like, oh, there's a bowl of dry food sitting on the floor. It's free feeding. I'm like, oh, that's not great. Or I can see, oh, they're using a lot of chemicals in the house, or they're spraying their lawns with chemicals, or they're using a lot of scent diffusers or candles. I can see all that and address it.
Right.
Yeah.
That's really interesting. Well, and it's also whatever you can't see, you're able to ask because you're in the home. So it's just a very natural conversation. Whereas if you're in a practice, it's a little harder. It's possible, but it's a little harder.
Yeah, because you don't have anything to go off of. Yeah.
Yep. So you do annual senior visits, wellness visits. What are your annual wellness exams like? What do they consist of?
Oh, I do, I guess, pretty much the usual. Obviously the physical exam. I can do blood work. I actually have an account with the VDI Labs, which is a pretty awesome lab that does vitamin D, cancer testing, and a whole bunch of other tests that regular labs don't do. So I try to get owners to do at least a vitamin D test if they can. And I almost always do some kind of therapies in my appointments, like acupuncture or light therapy. And then also, if they have supplements, I always double check that to see if the animal still needs the supplements, or I can correct it as well.
Hey there, this is Rob Ryan. I just want to say how much we enjoy making this content for you here. And if you are enjoying it, would you like our video down below? And would you subscribe to our YouTube channel? It sure does help us get discovered by more people like you who need information like this. And also down below in our description, the top link is to our trial pack. We hope you'll order one for your dog so your dog can have fermented superfoods that give them nutrition like they can't find anywhere else. Hard to get nutrients that are easily absorbed. Thank you very much. Now back to the show.
That's great. And I know that your doing a lot of like detox protocols. So where do you how do you decide who does a detox and what type of detox?
Well, most of my animals, they have something going on with them that the owners wants to address. So that's, so I will bring it up with them.
Mm-hmm.
So especially with skin stuff, cancer stuff, kidneys, liver, for sure. And then some gut stuff too. And I don't always go to detox like the first appointment, because sometimes people just don't get it, and they're like, what are you doing, like, just fix my cat's kidneys. And I'll be like, okay, let me deal with the kidneys first, and then maybe later on, maybe the second appointment, third appointment, then I could talk to them about doing detox to get rid of the toxins in the animal's body. Also, if the animal's been on shitty dry food, then I will probably push it a little earlier, because I know that pet's toxic. Yeah.
And are there different detoxes that you use? And like, give me an example. Is it nutrition detoxing? Like through nutrition? Is it herbs and tinctures? Is it, how do you think about detoxes?
Well, that's what that has to go into more of muscle testing or applied kinesiology.
Okay.
So what I learned through detoxing is I learned through you learn nutritional systems, first, and then now I'm learning another type of muscle testing through a cell core. And so basically, what I do first is I connect to the animal, and then I ask permission for muscle testing them. And then I try to then I do the thing called like a body scan. So body scan is where I touch every single part of their body, like their heart, their lungs, and see which organ is weak. If it's weak, then I let's say I find 3 weak organs. So then I ask which one's a priority, or which one's the most important one that the body wants to deal with. Let's say the liver is the priority. So I will focus on the liver, and I will ask if there's a stressor, and if there is, which one. And let's say, it's chemicals. Then once I found out that's chemicals in the liver that needs to be get rid of, then I have all these tests. I have these test kits, basically like little samples of different supplements, and then I put each supplement on the body against the liver, and then muscle test to see which one can clear this problem or this chemical.
Wow, that's interesting. Well, it's kind of like my doctor, who I've known for 25 years, who's a genius, does something very similar. And but what I'm curious is like, is there a reaction from the animals, or is it all intuited by you?
No, there's no reactions from the animal. They mostly just get bored, honestly, because it kind of takes a little time for me to do this.
Yeah.
And sometimes they just kind of try to walk away because they want to go do something else. They don't want to lay on the couch anymore. But it's all through, well, in humans, they will have you stick your arm out, and they will like have you, and then they'll press on your arm, right? Yeah. But for me, I don't have what they call indirect tester. So I use myself as one, using my fingers. So let's see. So if you can see, so I use my fingers in replacement of the arm, and I press on it. This for me will be a strong response. This for me will be weak response. And this is just the way I learned it, but there's so many ways you can do the finger, this method, which is better actually. You can the ring to ring, all kinds of different ways.
Okay, well, that's great. And the kinesiology, can you tell people just a quick little thing about what kinesiology means, what it is?
Yeah. So it's basically, well, the way I describe it to my pet owners is that it's just a way for me to talk to the body and ask it what it wants. And it's basically a yes or no answer. So what I do is I can just place a supplement on the body and ask if the body likes the supplement. And if it was yes, then it would be strong. And if it was weak, then it would be weak. And it's a way for me to narrow down what supplements this body could use to help this issue, because there is so many supplements out there for the liver, and which one would help this dog's liver, we don't know. Like with my brain, it's not smart enough to figure that out.
Yeah.
So the best way is to ask the body, because it knows exactly what it needs to heal itself.
Yeah.
I don't heal them. The body heals itself, and I just give it a little help.
You ask the right questions and you're the conduit.
Yeah, basically.
That fair? Yeah. That's great. And so you're in Rotterdam, New York. So just to be clear, we put up your website, nyhousecallvet.com, but you're full. You're totally full. So we need to be clear about that. But it's always good if you're in the area and you want to talk to Dr. Ying, you can reach out and maybe get on a waiting list. But my guess is you've been full for a long time. I mean, good vets that are doing house calls, there's always a constant waiting list. And so what area is Rotterdam? I didn't Google them all.
Yeah, it's in Albany. It's a little bit west of Albany.
Okay.
In New York.
Yeah. Okay, great.
Yeah.
Upstate. So what mostly do you get in terms of why are people asking you to come? Are they just wellness mostly, or is it like cancer or?
It's funny. I actually don't have a lot of cancer cases right now. I used to. I most of the time is because they have the pets issue and they want me to address it.
Okay.
I don't have a lot of wellness type of visits, actually.
Okay.
Yeah.
Yeah, I mean, it's really basically makes sense. So, and then do you do any other complementary medicine practices on them, whether it be, things like acupuncture, chiropractic, anything like that?
I do acupuncture, and I have a light therapy pad with like a little device.
Yeah.
I have an ozone machine. I have two ozone machines, actually. I have a PMF unit.
Yep.
That in terms of devices, that's kind of basically all I have. The most thing I do is acupuncture if the animal allows it. Sometimes they don't.
All those poor animals that aren't letting you in. What's the light pad that you're using? Like, what do you use it for?
It's not. So it's not like a fancy cool laser like a lot of vets do. Those class 4s. That costs something like $20,000 or $30,000. I don't have that kind of money, so I got this. It's a little something about this long, like this. It's like a little pad. I can just kind of wrap the animal around it, and then it has red light, infrared light, and blue light. And it has different frequencies that I can set. Usually it's like 4 settings, and I just muscle test those. Okay. I just muscle test which the animal wants, and if let's say this animal have a knee problem, I just wrap around the knee.
Yep.
And they love it.
Hey, that's awesome. That's great. Yeah, those light therapies, I've come to learn a lot more about light therapy. It's pretty amazing, the different wavelengths and colors, what they do.
Yeah. So the way I tell people to simplify is they decrease inflammation in the body, so therefore decreasing pain, and it also helps speed up the healings. I don't go into the frequencies that much, but each frequency has a propensity for different type of tissue in the body. So like the musculoskeletal tissue versus an organ. I use it a lot for even just kidney disease. I know that's not usually what you hear, but the low level light, not the class 4s really, but they actually can help the kidneys, be a little better, especially those chronic kidney disease cats.
Wow, interesting. Why is that?
Well, I think it has to do with the light's ability to increase blood flow. So the cats with the chronic kidney disease usually is because it's due to the fact that there's not enough blood flow to the kidneys and causing damage. So if you increase blood flow, and then the kidneys becomes a little healthier because it's being perfused properly. So, and that's what a lot of Chinese herbs do, like the Remania herbs, the formulas. That's what they do, is they increase blood flow to the kidneys, to make them a little healthier. So I tell people there is like, inside the kidney, there's like a healthy kidney cell, and then there's a dead kidney cell, but there's also a sick one that's damaged. So obviously the dead one we can't do anything for.
Yeah.
But the sick one, we can actually get it healthier by treating it, with light therapy, with Chinese herb acupuncture and stuff like that.
Wow. Okay. That's great. That's very interesting. So, the on the house call side of things,
Mm-hmm.
but how have you found people have opened up to more natural, holistic, whatever we can call it, label anything? Are people getting more comfortable with that sort of thing, or?
Yeah. Oh my gosh, yes.
Yeah.
I mean, I could be super busy if I want to, but that's not good for work-life balance, right?
Yeah.
But yeah, I could. People are asking for these things so much more now, like so much more than before, even just like 5 years before.
Really?
Yeah.
5 years ago? Wow.
Even more than 5 years ago. Every year there seems to be more and more people interested and asking for it. Yeah.
What would you say to, we know there's a vet shortage in general. We know there's a real shortage in holistic, naturopathic, integrative vets,
Yeah.
What would you say to young veterinary students, right, where they're thinking of it or they're in veterinary school? What would you say to them about, having a successful practice, like, thinking about holistic? What would be your advice to them?
I would say look into it. Oh my gosh, if I can talk to vet students, I would say go for it. There's a lot of conventional vets, that move to become holistic vets. But I don't think there's any holistic vets that go back to being conventional vet. So that's kind of tells you something. And there's so much more job satisfaction. The animals like you better. For reals. You can do more to help them with the natural therapies. So I describe it as in having more tools in my toolbox. If I have a dog with arthritis, like in a conventional medicine, I can give it NSAID, which is like a pain med, which is actually not good for you because it causes leaky gut, which is not great. But in holistic medicine, I could do light therapy, I could do acupuncture, I can do PEMF, I could do homeopathic like arnica or Tramiel or Boswellia. I have so many things I can do to help this animal, and it works. It really, really works. And sometimes it works better than drugs too.
Yeah.
And it heals them. It heals the animals, and it doesn't create side effects.
Yeah.
So I'm saying, please go into holistic medicine. Someone's trying to say.
Yeah. And what would you say for a young vet listening, going through, Cornell Vet School or any great, veterinary school? What would you say would be the best one or two more modalities to start looking at in terms of demand, in terms of, biggest bang for your buck, all of that?
Yeah, I would say acupuncture. I call acupuncture the gateway drug to holistic medicine, because it's much more acceptable. People know people know about it. So
Yeah.
people are more willing to let the animals get acupuncture. And then once you do that, you can go into, I would say, diet. And then chiropractic is also very popular too.
Yeah.
So I would say go to do acupuncture first for sure.
Yeah, that's great. No, that's great. Sounds like great advice. All the things that we hear at our show with other vets, you've echoed the same similar things. And
can I make one more thing that I just thought of?
sure.
If you are not really into energetic medicine, there's something else you can do that's not so woo-woo, that's an ozone. Ozone is so easy, so safe for the most part. I mean, you just gotta use it, right? Like anything else, right?
Yeah.
And it's cheap to do. You can buy a unit for less than $1,000 at O3 Vets. You can buy the cheapest unit and can start using it, and you can have your text, administer the ozone. You don't have to do yourself, and then it helps so many animals to decrease inflammation, help increase oxygenation in the body. It's really good for cancer. It's really good for gut issues. Just basically endless amount of things you can use it for. Oh, bacteria issues like infections, stuff you can't clear, like otitis, the chronic ears they cannot, you just, stick some ozone gas or ozone saline in the ears, because you can clear that stuff out.
Yes. Well, and I was just thinking about my dentist. I gargle with ozone water before and after, and for 60 seconds, and then if there are certain procedures where they need to sterilize, they use lasers and ozone gas.
Wow. Your dentist do this?
Yeah.
That's
and
amazing.
and so you get these incredible results because like even if I have a relative that just had from the same dentist a root canal, and they shoot laser to sterilize and also ozone gas, really, and it can get, because it's gas, it gets deep in.
Yep, exactly.
As opposed to the other stuff, which is basically injectable bleach, and it won't necessarily reach in all those super fine crevices. But the other thing that ozone reminds me of is Dr. Margot Roman. We did you know her?
Yeah.
We did a wonderful magazine called Dog Microbiome Magazine, by the way, .com. Oh, I have this up. I'll put it right there. Dogmicrobiomemagazine.com. You can just, for free, you can pull up the digital version. And she wrote an article in there about this miraculous story of, I think the dog's name is Atlas. And it is an incredible, it'll rock your socks off, this whole story. And she uses ozone rectally before giving a fecal transplant. And the reason is it breaks up the film.
The biofilm.
The biofilm, which is designed to protect us, but it can, right?
The biofilm is designed to protect the bacteria, the bad ones.
Yes.
Yeah.
And you want to break that up. Why?
Because you want to get rid of the bad bacteria, right? So you want to get rid of the protection.
Yeah.
Yep.
And then it absorbs the good clean fecal transplant. And she cures these dogs with these crazy miracle stories, which you could read about. But I think you're dead on ozone. It's cost effective to purchase and invest in. It's a great investment, and per treatment, it's like doesn't cost you anything, and you can charge. You can pay off your unit really fast and provide these profound results.
Yeah, you can. Oh my gosh, it's amazing, and I think every vet clinics should have one, because if you're doing surgeries, you can clean it out, the surgery site with that before you close. Like you said, the dentals. I actually brought my unit to my dentist, so I could put it off, with my teeth because my dentist don't have one.
Mm-hmm.
Yeah. And even have you heard of Ozone?
Oh, sure.
Yeah. For the joint injections, joint problems, ACL tears, and things like that.
Yeah.
And I actually do fecal transplants. I just don't do them that often because I don't like doing them. It's really stinky.
Yeah. Yeah. It's a dirty business.
Yeah.
But so worth it. My dogs, I've had senior dogs, and I have one dog now named Gus, and he's 7. So he's still young enough. But when I had my senior dogs, I had labs, big labs that lived to 16. And, you have to to maintain a really high quality of life, you have to do a few things, you got to stay on top of it. And so we've done, the big syringe, which you pull, you take the ozone, it's just gas. It's just, it's invisible.
Yeah.
We've just put that in rectally because it gets in the system
very quickly.
Just for that reason alone. But I've also done ears. I'm just thinking about all the things you just said. And then I've done prolotherapy. It's called Prolozone or prolotherapy?
So prolotherapy has no ozone, but if you add ozone into solution, then it becomes Prolozone.
Yeah, I've done that. And I've also done that. Yeah, for one of my dogs. And trying to think of what else we've used ozone for. Topically certainly is really easy. Yeah.
Yeah, for skin things, healing injuries, the chronic non-healing wounds.
Yeah.
Oh, can I tell you a story?
Please.
So this is before vet school. I was volunteering at the Taipei Zoo. This is in Taiwan, and they had the Taipei Zoo has a relationship with the Thailand Elephant Conservation Center. And so they invited us to go over there to see their facility, and I kind of tagged along. I was just like a little volunteer, Yeah. But I spoke English, and I was helping them translate their emails.
Okay.
So when I went there, one of the biggest problem with elephants is when they get a foot injury. Sometimes they can't. It's very hard for them to heal because they're so big.
Yeah.
And their blood flows aren't that great to start with. So all the stuff they were doing for these elephants, having these foot shoes they made up and all these things they were doing, and it wasn't really helping that much. Wow. Then they said that the thing that helped the most was ozone. So they were limb bagging these elephants' foot with ozone in order to heal those chronic and non-healing wounds.
Yeah.
Because if elephants' foot can heal and they cannot use their foot, they have to be put down because there's no way an elephant can survive on 3 feet, not like dogs can or cats.
No way.
So I actually knew about ozone before vet school from Thailand, this Thailand Elephant Conservation Center.
Wow. I told a friend of mine she had this chronic foot infection that she got overseas, and she had some kind of stops and starts. In other words, she was excelling in her progress, and then she'd take like 2 steps backwards. Oh. And I said to her, she should get intravenous IV, all kinds of good stuff there, and then put a bag on her foot with ozone.
Yeah.
Yeah. And I was just trying to think, like, what could she do she didn't have any doctors that would do this, but what, could she find somebody that could do this for her? And she did it once and said it worked great, but once is not enough. I think she needed to do it a few times. But yeah, you're bringing this up to me with the elephants. So how many treatments did they need? Because this is all gas. So you put a bag around, you put a tube in, and you fill it up with the gas, right? And the gas just does its magic.
Yeah. Well, you have to wet the area first, make sure it's wet.
Oh, you do? Okay.
Yeah. And then you put the ozone in and so let it sit. I actually don't remember. This is before vet school.
Sure.
All I did was look at the pictures. I was amazed, and I'm like, cool. But yeah, they were using this stuff. So this is 2000 and 2000, I think I went over 2005.
Wow.
So they were using this in Thailand in 2005.
Yeah.
Why you don't have more of it in this country?
I don't know. My where I lived before, I had a pool and a jacuzzi that had an ozone machine that all the water, as it was filtered, it would hit ozone during certain times of the day, because this stuff is so I guess would the word be antiseptic?
Microbial.
Antimicrobial. Yeah. And it's basically like stronger than bleach, but there's no bleach. There's no chemical. It's just gas.
No.
So for anybody who's trying to wrap their head around it, just do a little bit of Googling, watch a few videos. But this stuff is just gas. And you don't want to, there's some things you want to like be careful about. You don't want to breathe it in and all that. There's certain things you want to be careful about. But ultimately, it's super safe. You just don't want to do it.
No.
You just want to practice it without understanding what you're using and what you're, because it's super powerful.
Yeah,
I'm so glad you brought up ozone. That you're bringing up all these stories that it's truly an additive, natural. I mean, what could be more natural than gas? Like just
Oh yeah, and it, like I said, it's not toxic. Well, like you said, the only thing that it is toxic to is lung tissue. So you don't want to breathe it in. But otherwise, you can inject it into the body cavity. You can inject it into bladders. You can inject it into tumors. Yeah. You can obviously inject it into veins for sure. Whether it's through ozonated saline. They don't recommend doing straight gas, although I have heard people who does it. You can do major autohemotherapy, which is you take the blood out. You mix it with ozone and you put it back in.
I bought a long time ago some ozonated olive oil.
Yeah.
And you could rub that right on a wound for your dog.
Oh, yeah. Yeah, you can do that. You can actually, if I'm not wrong, I'm not sure it's olive oil or different oil, but you can actually, I think, apply to eyes too.
Wow.
For the the corneal ulcers and stuff like that.
This was more solid. I mean, I kept it in the freezer, but
that's perfect.
Yeah, because then it doesn't degrade as fast. But it's so cool when you smell it. It's like it smells like an operating room. It's like really clean.
Yeah, it kind of reminds me of like the stormy day with the lightning, and then that's ozone.
That's ozone. When you have that weird, lightning's about, the rain's about to happen, it's like, what is that smell? It's like so odd. That's ozone. Yeah, it's all being created naturally.
Yep. That's what it is.
Yeah.
Regarding your friend with the chronic foot wound, I would this is some suggestions. I recently got introduced to noni fruit. Have you heard of it?
Oh, sure.
Yeah.
There's a network marketing company that sells it. That I can't remember the name
really?
of. But yeah. It's a friend of mine sold it at one point, but it's pure. It's an antioxidant. Tell me.
Well, I went on vacation to Hawaii. I went to the Kauai Island, and there's actually a noni farm there. So I went on a farm tour, and the farm is called Real Noni, like real and fake, Real Noni. And it turns out to be this awesome fruit that is super high antioxidants, anti-inflammatory, helps with pain, autoimmune diseases. And they also make an oral version, which is the leather, and they make a topical version and they call it a lotion. And the lotion has really strong healing properties as well. So I'm thinking it's also antimicrobial as well and anti-parasitic. But anyhow, so for your friend with the chronic wound, you could apply she can also apply some of that noni lotion on it to help speed up the healing process too. That's how I'm thinking. Yeah.
Wow. Thank you for that. I'm going to Google that. I just did a quick little look. It's realnoni.com. I'm
Yeah.
going to be all about it.
It's super cool, by the way. It's the owner, the farmer. His name is Steve, and he's super knowledgeable. And he sent his fruit out to be analyzed. I think in the University of Hawaii, he works with somebody there.
Yeah. Wow, that's great. I could see, like, I would make up a concoction of the noni topical with some like really powerful manuka.
Ah, yeah.
You know, or, I mean, and you know, it's you with all this natural stuff, you could just make up your own concoction and see all these things are so complementary in a lot of cases, you know.
Oh yeah. I think I was applying noli on myself on this one area that is a little bit of my shoulder's a little painful. So I applied noli their icy hot lotion on this area, and then I put a castor oil over it. Yeah, so you know, it just gets all absorbed into my skin, into the joint.
Yeah. No, that's great. That's amazing. Well, this is a really great conversation. I hope for your first podcast this was easy for you.
But yeah, it was actually really fun. Thank you.
I told you. This is great. I mean, I think people are going to get a tremendous amount of value out of it. And, you know, this is, the more that we talk to vets about the things that are working, we see it's these things that are additive, I'll just maybe probably make up a word, subtractive. They're not, you know, they don't have all these crazy negative side effects and all these things you have to go in and fix later or repair. You know, you always want to try the things that are, I don't know, I guess I don't want to say easiest, but I do mean easiest in a lot of cases. They're less, how would you say some of these therapies, how would you classify them?
I say less harmful.
Yeah.
I don't know if we all took an oath. Okay, all the vets took an oath to do no harm. And I stick by that philosophy. You know, I would definitely use the item that has produced the least harm first.
Yeah.
And if that doesn't help, then, you know, I'll go down the chain rather. Yeah. But yeah, so that's why I like holistic medicine. Most of these don't have a harm to the body. So I use them first. And if the animal is super painful and they really, really need like an opioid or an NSAID, then fine, you know, we do that. But at the same time, I also give like let's say if I was doing an NSAID, I would give like maybe a liver support or some kind of detox.
Yeah.
Or maybe ion gut, even because NSAID creates leaky gut. So maybe an ion gut, which is a fumic and fulmic acid liquid supplement to help seal the leaky gut itself. So the animal's not as affected by it. Or a Chinese herb, you know.
Yep. No, it's great. And, you know, it's like, I think it's as simple as there are things you could do that have negative side effects. There are things you could do that there are side effects, but they're only beneficial, additive. I like to say, you know, additive. So they're both addressing you can do either one of them to address an issue, but instead of the negative side effects that are, you know, maybe toxic or whatever they could be, the other type of treatment has all these additional benefits. Like, for example, just the ozone. Okay, so it's antibacterial, antifungal, antiviral, or whatever, all of that. And it's oxygenating. It's like throwing oxygen right in the bloodstream and the system can absorb it. So you've at least got that.
Yes.
But not with antibiotics, which are antibiotic, but not antifungal, antiviral. So, you know, I think that people, if they can be thinking about these things in these ways, they can open their minds and their hearts up to trying these things maybe first if you're not too far gone.
Yeah.
You know, but I'm with you. I think with the animals that are really seriously ill or sick, quality of life is paramount. So if you have to give an opioid or a NSAID, you do it. That's just the way it is.
Yeah.
Certainly any great vet would say the same thing. You want to get the animal well. So Dr. Ying, thank you for being with us today.
Oh, you're very welcome. It was definitely my pleasure as well.
Good. Well, I'm glad you had a good first experience with a video podcast. And thanks everybody for watching and listening to us today. Have a great day.